Provincial Health Officer Dr. Henry is warning it's peak respiratory virus season.
We will continue to see high rates of influenza and RSV for the next few weeks. The provincial wastewater data shows us that influenza A levels continue to increase overall across the province.
Henry says in the past week, about 10,000 people were in hospital, many with respiratory illnesses, particularly young people.
While we're not seeing as much respiratory illnesses as people are seeing in other parts of Canada and the world, where immunization rates are lower, it is a reminder of the importance of vaccinations and the healthy habits overall in limiting the impact.
It's not as much of a tsunami as it was last year. Last year was crazy. Now, it still is bad, but we're also dealing with the ramifications of a healthcare system that's shaking.
Last week, the BC Centre for Disease Control reported a third child under the age of 10 had died from flu-related causes. Henry says none of the children had been vaccinated against influenza and all developed a secondary bacterial infection.
It is so sad and tragic when we know that young people can be protected from these infections.
When it comes to vaccinating people, we have the biggest number in the entire country. That's still not a lot, and that's not enough. And it's even less in kids.
As of Tuesday, more than 1.5 million doses of flu vaccine have been administered, a lower vaccination rate than this time last year.
People talk about how, I got vaccinated, but I still got sick. So what's the point? We need to erase that. The risk of severe illnesses, the risk of hospitalization, the risk of death, that goes down with the vaccination.
Health Minister Adrian Dix says while hospitals are facing immense pressure, he maintains there is capacity to deal with an unexpected surge of sick people in the coming weeks. Janella Hamilton, CBC News, Vancouver.